Good day everyone. My name is Christopher Siderbita and I'm with my partner Miss Ana May de Los Reyes, and the assigned topic for us to report is about atherosclerosis. So what is atherosclerosis? Atherosclerosis is indeed a specific type of arteriosclerosis which refers to the general hardening and thickening of the arteries. Atherosclerosis occurs when fats, cholesterol, and other substances accumulate in and on the artery walls, forming deposits known as plaques. These plaques can lead to the narrowing of the arteries, restricting blood flow. This process can result in reduced supply of oxygens and nutrients to various parts of the body, depending on which arteries are affected. Additionally, the plaques can become unstable and rupture. When a plaque bursts, it can trigger the formation of blood clot at the site, which can further obstruct blood flow or potentially travel to the other parts of the body, causing serious complications such as heart attack or strokes. While atherosclerosis is often associated with heart disease, it can affect any artery in the body, including those supplying the brain, kidneys, and limbs. This widespread impact underscore the importance of managing risk factors and maintaining cardiovascular health to prevent the progression of atherosclerosis.
So the next is which is the prevalence. In the arteriosclerosis is a leading cause of vascular disease worldwide. And the major clinical manifestation include the ischemic heart disease, ischemic stroke, and peripheral arterial disease. In the high income countries, so this have been significant declines in the incidence or mortality from ischemic heart disease and ischemic stroke since the mid of 20th century. However, in the low middle income country, trends have been more varied, with some supporting declines and others reporting increase. So, the ischemic heart disease, this often referred to a coronary artery disease. This condition occurred when the plaque obstruct blood flow to the heart, leading to the chest pain, heart attacks, and heart failure. And also the ischemic stroke, so this happens when the blood clot or plaque black blood flow to the brain, resulting in a brain cell damage. And also the peripheral arterial disease, so this affects the blood flow to the legs, usually in the legs, causing pain, numbness, or even the tissue damage. The next one is the signs and symptoms. So we have three parts that affects on the body of the arteriosclerosis. So first is the symptoms related on your coronary arteries included. So first of that is the symptoms of arrhythmia or unusual heartbeat or irregular heartbeat, and also your heartbeat too fast or too slow. And the next is pressure or pain on your upper body, including your chest, your arm, and neck or jaw, and this is known as an agenia. Next is the shortness of breath, occurs when your heart cannot pump the blood effectively. So the next symptoms is related to the arteries that deliver blood to your brain include, so the first is numbness or weakness on your arms or the legs. Second is the hard time speaking or understanding someone who's talking, and dropping your facial muscles, paralysis, severe headache, and trouble seeing in your eyes, on your one eyes or your both eyes. And the next is symptoms related to the arteries in your arms, legs, and pelvis. Include the first of that is leg pain, walking, cold, intermittent claudication, and second is numbness, or you may feel tingling or low sensation. Next is clawed feet and hunching or burning in your toes and feet when you're at rest, and also in that symptoms may worsen at the night when you're lying down. And last is a frequent sores or infections on your feet that won't heal.
So next is we're talking about the atherosclerosis and its pathogenesis. Atherosclerosis is largely that result of combination of family history as well as external modifiable environmental factors. So starting from the family history means a genetic predisposition for dyslipidemia, hypertension, and type 2 diabetes. Um, the external factors would include diabetes mellitus, hypertension, and smoking, as well as dyslipidemia, which usually means high-low density lipoproteins and low-high density lipoproteins, or the HDL. So now starting with dyslipidemia, because high density lipoproteins aids in transport of low density lipoproteins from the periphery back to the liver for breakdown. Low levels of HDLs allow more rapid accumulation of LDL in the vessel walls. This combination with genetically high level of LDL means that more LDL is there to diffuse across the damaged endothelium and accumulate in the intima layer of the arterial wall. Other factors, such as smoking, will directly worsen dyslipidemia via unclear mechanism. Smoking also results in inhaled free radicals entering the blood, which cause direct damage to the arterial endothelium, allowing for allowing more LDL to diffuse across it and accumulate in the intimal layer of the artery wall. Hypertension, which is chronic high pressure forces acting against the artery wall, and diabetes, which consists of glucose excess altering the endothelial cell metabolism, will both also cause direct damage to the arterial endothelium, resulting in more LDL diffusing across it and accumulating in the intima of the artery wall. LDL in the intima is then oxidized into lipid that trigger chronic inflammation in the vessel wall. This results in elevated systemic markers of inflammation in the blood, which can be detected as elevated serum C-reactive protein, or the CRP. Serum CRP can also be evaluated as an independent predictor of atherosclerosis. Once chronic inflammation is triggered in the vessel wall, that inflammation recruits monocyte into the blood vessel wall, which then differentiate into macrophages. The macrophages phagocyte those they oxidize LDL and become filled with fat. Henceforth, these cells are termed foam cells. This streak of fatty tissue can be observed between endothelium and the smooth muscle layer of the artery. And these fatty streaks, as they termed, can actually be seen on pathological specimen, which is an early indicator of developing atherosclerosis. Now, back to pathophysiology. Over time, the foam cells accumulate in the intima to form an enlarging lipid core. This lipid core has a fibrous connective tissue layer accumulating around it, forming a fibrous cup. Foam cells also release many inflammatory mediators which increase the proliferation of media smooth muscle. These cells detach, enter the lipid core, and further enlarge it. Eventually, this lipid core with its surrounding fibrous cup develops into atheroma, a lipid-filled plaque that can enlarge and eventually impinge or block vessel lumen in the artery or in the artery wall. This is atherosclerosis. So, over time, the atheroma can calcify and further enlarge, and then can either remain stable, which means not rupturing or rupture, which results in the complication of atherosclerosis. So that is the pathogenesis of atherosclerosis.
The next one is the laboratory and diagnostic exam. So the first of the laboratory and diagnostic exam is the history collection. So you are gathering comprehensive medical history to help to identify the risk factors, the symptoms, and the pattern related to a vascular or cardiovascular issue. So the second is arteriography, or also known as an angiography. So this is an imaging to use visualize arteries. And also, it is a contrast dry dye is injected into a blood vessels, and also an x-ray are taken to detect the blockage, narrowing, or abnormalities. So the next is the CT scans or computed tomography. This is a specialized X-ray technique that produce to detail a cross-sectional image of the body. So also we have an MRI or magnetic resonance imaging. This is a non-invasive imaging technique that uses strong magnetic fields and radio waves to create a detailed image of our organs and tissue. And also we have an MRI or magnetic resonance angiography. Also this is also same as a specific type of MRI that focus on the blood vessels. And also we have an ECG or electrocardiogram. So this diagnostic test that records the electrical activity of the heart. And the last which is we have echocardiogram. It is an ultrasound based test that provide image of the heart structure and function. Next one is the medical and surgical management. So in medical management, we have first the anticoagulant or antiplatelet therapy. Example with we have that is streptocaines or and the aspirin. And the second is lipid lowering agent. We have the nicotinic acid or niacin. It decreases the synthesis of the LDL cholesterol, and triglycerides. And also we have the fibric acid, and also we have the 5-nofibrate. It reduces the synthesis of the cholesterol. And also we have the HMG coenzyme reductase. We have the lovastatin, atorvastatin, simvastatin. So these three is they decrease the triglycerides, LDL level in serum also decrease the synthesis of the cholesterol. The second is surgical management. So we have first is main surgery is PTCA or the percutaneous transluminal coronary angioplasty. So this is a surgical technique in which balloon tip catheter is inserted and floated into a blocked coronary artery and then implanted to a mechanical dilate the artery and help to ease the blood flow. And also we have CABG or a coronary artery bypass grafting. So this is used to treat the coronary artery disease condition where the coronary arteries which supply the oxygen-rich blood to the heart muscle.
So next is the nursing management. So in managing atherosclerosis or the person with atherosclerosis, nurses play a critical role in promoting heart health through comprehensive health education and lifestyle modification guidance such as dietary changes. So nurses advise patients to adapt to a heart healthy diet which is involves reducing the intake of saturated fats, cholesterol, and sodium. So this type of diets helps lower the risk of atherosclerosis and other cardiovascular diseases by improving lipids profiles and reducing blood pressures. Another is the smoking cessation for patients who smoke. So nurses provide resources and support to help them quit. These may include counseling, recommending nicotine replacement therapies, or connecting patients with smoking cessation programs. Quitting smoking is crucial for reducing the risk of atherosclerosis and improving overall cardiovascular health. Another is physical activity. So nurses encourage patients to engage in regular physical activity tailored to their abilities. Exercise helps to maintain a healthy weight, reduce blood pressure, and improve levels. All of which are importance of preventing heart disease. And lastly is the risk factor modification. So during health teaching, nurses emphasize the importance of controlling risk factors such as blood pressure, cholesterol level, and blood sugar for patients with diabetes. These can involve medication management, lifestyle changes, and regular monitor to prevent or manage atherosclerosis. So, by addressing this, nurses help patients reduce the risk of cardiovascular diseases and promote long term heart health. Last is the prognosis. So, atherosclerosis is a chronic condition where plaques made of fats, cholesterol, and other substances build up on the walls of arteries. These buildup can cause complications such as heart attack, stroke, and peripheral artery disease. The severity and prognosis of atherosclerosis depends on several factors, including the extent of the disease, which arteries are affected, the stability of the plaques, and how well risk factors like hypertension, diabetes, and smoking are managed. Localized are atherosclerosis, where plaque buildup is limited to a specific area tends to have a better outlook compared to widespread atherosclerosis that affects multiple arteries. Stable plaques, which are less likely to rupture, pose less risk than unstable plaques, which can break open and cause serious complication. Effective treatment involves using medication like statins and antiplatelets, as well as making lifestyle changes such as quitting smoking, eating healthy diet, and engaging in regular physical activities. So, these measures can significantly slow the progression of the disease and reduce the risk of complications. Even though atherosclerosis cannot be completely reversed, timely intervention and adherence to treatment can help stabilize this condition. This means patients can manage their condition and maintain a good quality of life for many years. Aggressive management of risk factor has been shown to reduce the incidence of cardiovascular events by up to 30%, highlighting the critical role of prevention and education in improving outcome for those with atherosclerosis. So that's it for our report. I hope you guys learn about atherosclerosis. Thank you for listening and have a good day.